Hi, everyone, and welcome to another episode of Wellness Day, a podcast coming to you every Wednesday here from the Jehangir Wellness Center. My name is Kavas Jehangir, and here from the JWC studio. Today, I've got the stalwart of Jehangir Hospital in Paediatric Surgery. I've got Dr. Dasmit Singh. He's got over 35 or nearly 38 years of experience in the field and beyond. So it's an absolute honor to have you here on the show today. Thank you so much for being here, Doc.
Thank you so much, Kavas.
So let me just first up ask you, before we get into pediatrics, children, and so forth, what does wellness mean to you?
Um, Actually, wellness is a pretty broad terminology.
Exactly.
I would say wellness means a feeling of being well.
Okay.
It's not merely the absence of a disease.
Right.
So as long as one feels well, so that would be physical, emotional,
Yeah.
mental, and all put together. Then I think you're well.
Yeah. Well, no pun intended, but what does that mean to you? Like when you're saying being well to you, what is the first thing that would make you feel that, yes, I'm well?
Well, if I don't have any disease, I'm not on any medications,
Right.
or even if I am, I'm able to accept that very well.
Okay.
That I would say would be wellness.
Okay.
So as long as you're accepting every day which is coming your way,
Right.
and dealing with it as best as you can,
Okay.
and you live in a kind of space that there's no sorrow, there's no stress. That I think is real
Okay.
wellness.
Right. See, I'm going to lie a little bit. I was just trying to try and push you into a certain answer because we're both biased in that sense, or at least we have a common thing, or passion for music, and particularly we're both drummers. So I was hoping that you'd say that I'm happiest when I'm playing the drums.
I am.
So that's
I actually am.
that's the answer I was going to get to at one point, but we'll get to your drumming or our drumming towards the later part of the show, maybe. But yeah, coming back to the wellness, and as I said, you're one of the stalwarts in the city for pediatric surgery. You've got years and years of experience now. What are the most common aspects of pediatric issues that come to you that
Yeah.
that you need to deal with?
Firstly, to define pediatric age group, it
Yeah.
goes all the way from a newborn,
Right.
or even before the child is born,
Okay.
fetal
Yeah.
anomalies, and goes all the way up till 18 years of age.
That it goes up to 18 years. So a pediatric.
WHO definition is 0 to 18. Uh, but the commonest condition that we see are maybe in infants and in children less than 5 years. And most of them are either congenital conditions, or some kind of infections, inflammations, or some kind of tumors, or
see.
other injuries and things like that. So, if I have to tell you the commonest surgeries that we do,
Right.
maybe hernias, undescended testes,
Okay.
circumcisions for medical conditions like phimosis. Then another specific disease is hypospadias, where the whole of the urine is not situated at the tip of the penis.
Right.
It's situated somewhere short.
Okay.
And to repair that in a single stage, we are specializing in
I
that
see.
field.
Okay.
Uh, so we do all kinds of various repairs and get them corrected.
Okay.
Other conditions like intestinal obstructions, or the patient is vomiting because of some kind of disease process. Sometimes the patient has some tumors in various places of the abdomen or thorax.
Okay.
Then lung infections, which then proceed to go outside the lung.
Right.
So
right,
lung
right.
infections generally, which are called as pneumonia, they are treated by the medical pediatricians.
Okay.
Whereas the minute it becomes outside, it's called as empyema. It's like literally pus in the thorax.
Okay.
So that we are able to do endoscopically, so
I
by
see.
thoracoscopy.
So quite a range of things that you see.
Absolutely.
A lot of them, as you said, are congenial and so forth. So actually, the next question I was going to ask is, what we can do, or what can parents do, or people do, or doctors recommend to keep it down or prevent them as much as possible. But obviously, in some cases, you can't prevent some of these things. But in your experience, what are the things that where there is preventative stuff available?
There are a
what
few
can we
things
do?
that parents can do, especially children born of mothers with anemia or folic acid deficiency.
Yeah.
If they are treated well before they actually become pregnant,
I see.
That's one good way of preventing congenital anomalies.
I see.
Because
So, just generally speaking,
Yeah.
anemia can cause so many different
can
issues.
cause a lot of issues. Folic acid deficiency, we know for sure that it leads to a whole lot of spina bifida, occulta. So those kind of nerve abnormalities, hydrocephalus, etc.
Right.
So all that can definitely be
So, start by actually having a healthy pregnancy, so to speak.
Yeah. And many of them are detected during pregnancy.
Right.
At which point of time, some diseases, then they come to our fetal clinic where we are able to counsel them.
Okay.
And some of them, we are able to just carry forward the pregnancy without any worry.
Right.
Many of them are going to reverse by the time the child is actually born. So every pregnancy which has a congenital malformation doesn't have to end in a disastrous medical termination.
Okay.
I would say the vast majority of the patients are well at birth. Few of them who do persist with some problems, we are able to operate on them or without surgery also cure many of them. And some who have very, very major anomalies, multisystemic anomalies which are non-curable.
Yeah.
Those are the only patients where we would counsel them, and then the patients can take the decision whether they want to continue the pregnancy, look after an invalid child, or would like to terminate them. That decision ultimately belongs
of
to
course,
the
the parents. And coming to the parents, just being in the field that you're in, obviously our interaction is mostly with the parents and decision making and so forth. In your experience, where have you found that parents pay too much attention to where it's not necessarily that much of a worry, and vice versa?
I think in everything.
Okay. You think they worry too much?
They
as
worry
parents?
too much. Parents worry
I
too much.
suppose that's
I
natural.
think in earlier days when people used to have 9 children, they wouldn't be too worried about them. Few would die of some disease.
Right.
But now with nuclear families, parents are rather worried about every child.
Yeah.
But I think overbearing parents also produce a lot of problems in their children.
You actually see that happening. It's not just something that people say. You actually see that happening
No,
medically.
absolutely. The way that the child enters our OPD, you know exactly what is happening in their house.
Wow.
So some of them, they come very well prepared. The parents have prepared the child very well. The minute you ask them question, the child is cooperating with the questioning, cooperating with the examination. You just say, okay, I need to examine the child. Go and quietly lie down on the examination table. And there are some who are howling. You can hear them howling even outside the door. Just because they've entered a hospital, they'll be howling. So it's all the level of preparedness that the child is subjected to at home.
Right.
So that's good parenting. A very positive parent or positive parents will produce very positive children.
Of course, yeah. Taking the stress out, I suppose, of going to a hospital. I guess that comes back to the mental aspect of it, of wellness.
Yeah, absolutely. So if the child can be taught wellness right from the beginning, the parents are aware, aware of it, and they treat the child as a semi-adult and train the child. This is what you're supposed to do. This is what is expected of you. All we are doing is just showing the doctor. If at all there's anything wrong, he will make you well. If you prepare the child well, then generally you don't have all these anxieties.
That's a really interesting, angle, because actually the next question I was going to ask you is that I've had so many guests that, we've talked about wellness, particularly with adults and so forth. But I was going to ask you if that changes, does wellness change for children in some aspects versus, adults? So my question was going to be, how does that, in your view, is something that should be looked at slightly differently when you're looking at the wellness of a child versus the wellness of an adult? And the aspect that seems so obvious now that you're talking about is just the simple applicability of the parents on how they treat the child is really the start of their wellness.
Absolutely.
So you answered my question before I asked it.
And actually, you can also make out a difference if the grandparents come along with the child.
Yeah.
The child is far more spoiled. So that's spoiled child behavior.
But is that are you saying that's a good thing or that's a bad thing?
No, it's not a very good thing.
No, it's not a good thing.
Yeah. Basically, the way the grandparents have dealt with their children is the way these parents are dealing with their children.
So it's coming down generation.
Yeah. When the grandparent has learnt over a period of time that makes absolutely no difference, whatever you do with the child, So they are far more lenient with their grandchildren.
Okay.
And if the parents try to correct the child, the grandparents are, no, let it be, no, nothing happens, no. So then that is what produces some kind of a insecurity in the child, because there's a kind of a conflict that they visualize in their
Right.
family. The grandparents are saying something, the parents are saying something, and then they are always taking the easier way out.
It's
And-
fascinating that you see that actually playing out medically, or the outcomes
Absolutely.
medically for the child.
Yeah, and these are the outcomes which I see being a surgeon.
Yeah.
Every patient coming to us, we are not operating on them.
Yeah.
So many of them are treated medically.
Right.
Or just with pure counseling, pure psychologically.
Yeah, it's amazing the power of just talking to a
Just
doctor can
talking
be.
to- yeah, absolutely. But you can imagine if the child is being seen by a psychologist or the pediatricians, so they see a lot more effects of this kind of behavior. So, and that has produced a big, wide autism spectrum. And that also is seen because of the screens, excessive use of screens nowadays. So, mobile screens and TVs and laptop screens. The more the child is exposed to the screens, the more the child gets disconnected from
Their body.
reality.
Yeah, that's the other question I was going to ask you is, are you seeing trends in lifestyle that are starting to play out in diseases and conditions that are coming to you?
Yeah, definitely, because we see autistic children a lot more nowadays.
Really?
Which was very, very rare earlier.
Okay.
In earlier days.
Uh-huh.
When the children were more physical, they were playing more on the fields rather than sitting cooped up at home.
So again, exercise.
Yeah. Exercise, interaction with other children.
Yeah, absolutely.
Yeah.
Yeah,
Then
that's
the
such a big
falls.
one.
So you, unless you run, you don't learn how to fall and then get up and then run again.
Yeah.
So that part is going, somehow towards the background. Even the parents are becoming too overprotective. So
Yeah.
they don't want the child to run. No, you'll fall. So don't run. So those kind of changes have made, a doctor's life also more difficult.
Interesting.
And the entire generational change is what we are also seeing because of this.
Wow. So where do you see then pediatric surgery going in the future?
No, pediatric surgery will remain.
Of course.
Yeah. So congenital malformations, they will
Yeah,
remain,
yeah.
which we are able to correct.
Yeah.
Most
Or let
of
me
them-
ask the question slightly differently. Where do you see the trend going in children coming to you?
No, the trend remains the same. I mean, overall, if we see statistically, it remains the same.
Right.
It's only the question of how we deal with the children that is changing.
Okay.
So we have to be far more sort of understanding, and we have to be far more tolerant. A patient throwing tantrum
Yeah.
when he's under your care, so taking out the the IV line, and they pull it out and they pull out tubes and catheters. That's far more than a child who would just cooperate the minute you would say.
Right.
It's not universal, but I'm saying that the trend is such that the incidence is going on increasing.
So that softer touch needs to
Yeah.
come back.
Yeah. So a touch where the child is, facing more of real life situations.
Yeah.
Rather than, a rosy picture as is painted by not by books, let's say, what they watch on the
Yeah,
screens,
yeah.
or by cartoons, etc. Those rosy pictures are not real. So that's one difference that we are seeing. So the counseling of children has become far more important.
Right.
We can counsel them, but ultimately the same counseling has to be carried out even there
Of course, at home.
at home.
Right.
So one trend which is directly related to this is the food habits and the problem that it is causing. So one, obesity.
We're
We
starting to see more and more
we
of that.
see a
now
lot
in
of
children.
obese children. And second is chronic constipation.
Wow. Okay.
Children are grossly constipated nowadays. And I would say at least 20% of my OPD will be just chronically
Oh, wow.
constipated children.
That's a lot
That's a very, very
for
large.
constipation.
Yeah, just constipation.
So how do we deal with that? Eat more vegetables.
Basically, that's what it is. But then you have to prescribe a diet. You have to make sure that
But they're following it. Yeah.
yeah. So they are following it. Now I can prescribe it. I can advise it. But ultimately, the parents have to follow it.
Yeah.
If they refuse to follow, or the child refuses to follow, then there's no way
Of
that
course,
child
just
can
a
be
piece
cured.
of paper.
And constipation in the long term is a very, very harmful thing
Absolutely,
because the
yeah.
child's growth stops.
Yeah.
If they're constipated, they don't feel hungry, then their diet goes down. they're basically eating the wrong things. Where fast foods have taken over the usual diets of the traditional family values. They are going
Right.
so they are changing. So that is a definite change that I'm.
But on the other hand, you're such a loved doctor, I think, also, and so successful because of your love for children, which, comes across in the conversation that we're having that I can see.
Yeah.
So, I mean, it's not all dim and grim. If someone comes to you, hopefully they'll be far, far happier when they leave. So,
Absolutely,
it's very nice to have someone like you talking about this and being able to address it with children.
Absolutely. The problem is that when I advise, I have to show myself as a very strict person.
Or do you?
I have to. Because otherwise the child is, or the parents, they are not going to listen to me.
Really? They'll just push you over?
They'll just say, oh, the doctor's only joking. And
That's interesting that you actually have to approach it that way.
We have to coach ourselves differently. We are presenting ourselves differently when we are talking to
Because it's
parents.
as you said, it's such an interesting dynamic. As you said, the child is sitting there, the parents are sitting there, the child is absorbing it at a different level versus the parents who are absorbing it at a different level. So it must be quite the handful
Quite
being
a
in that
tightrope
room.
walk.
Yeah, exactly. Tightrope walk is probably the right word.
It's another phenomenon used to be like, don't let the lady of the house know, don't let the child know what the problem is.
Yeah, which is so outdated, honestly.
Absolutely outdated. But then very often you see that yalla bahar patwa. Let the child go out.
Yeah.
I immediately stop them. I said, no, the child has the problem.
Absolutely.
Let the child listen to our conversation.
Yeah.
Let the child understand. Directly the child may not be able to respond or react now. But when the child goes on, when you are trying to coach the child, so this is what the doctor has said. The child cannot say, no, the doctor never said this.
Exactly. Yeah.
Because he was there
in the room
when the doctor said it. So that also helps the parents to control the child or implement the diet advice or whatever other advice that we have given.
Tightrope, as you said. But yeah, it is a tightrope. So what do you do for your mental well-being? Because I'm sure at the end of the day, it must be, you definitely need to have a release.
Very, very exhausting. Every OPD, maybe 10, 20 patients you've seen, it's extremely exhausting.
Fulfilling, I'm sure, as well, but exhausting,
So, because you also get a lot of complicated cases,
I'm sure,
which have, been operated elsewhere and then they've got some trouble.
Yeah.
So, I think the only thing which keeps me through is music.
Is your drumming. Releasing it all on the drums.
On the drums, yeah.
But what does your family have to say about that? Do they say that you're making too much noise at home?
No, I had to find another method. So, what I have now is I have an octapad. So where I can turn down the volume.
Oh, and you can put it in your headphones and then you can be your own nuisance.
Absolutely. Otherwise, the drumming used to be a very, very big hassle for my both my family as well as the surrounding neighbors. Everybody would come complaining, could you stop that drumming?
Yeah. No, I remember that when I was a child also, it's like I've obviously seen the hospital throughout my entire life, but I'd always remember you as a doctor because you were a drummer, not because you were a doctor. So I appreciate you being here, Doc, today. So thank you so much for being here. It's been incredible hearing your insights, particularly on the tightrope that you have to walk. And I'm sure it's so fulfilling when you get to see a child walk out happy and healthy. So thank you so much again for being here, Doc.
Thank you so much. It's been such a pleasure talking to you.
Thank you, Doc. Thank you all, and we will see you next week for another episode of Wellness Day. But before you leave, please do not forget to hit the like and subscribe buttons here at the bottom. Thank you.